And I hope you will also participate and share your voice in our meeting this morning. What I'd like to do is briefly go around and let everybody say their name and if they have a partner affiliation, what that is. If you're brand new to the coalition, this is your first meeting, please let us know that as well. I don't know if I need to pass this microphone or if we can just stand up and shout. What do you think? Shout? All right. Who wants to go first? Tam, do you mind if we do you first? Quickly. Everybody's got like 10 seconds.
Sam St. Clair, I am on the board and President America of the Bucks County Women's Advocacy Coalition.
Good job. Perfect.
Hi, my name is Kirsty Smith. I'm with Congressman Fitzpatrick's office. I'm one of the advocates in his office.
Welcome.
Thank you.
I'm Yoma Ullman. I'm a Penniswood resident, very interested in what you are all doing.
Yama, welcome.
Hi, Mary Tracy.
Good morning, I'm Laura Lazar. I'm the new Director of Relationship Development at the Peace Center. This is my second week. So I'm very excited. This is my first meeting here, so I'm looking forward to getting to know everybody.
Welcome.
Thank you.
Good morning, and I'm Kathy Craig with the Peace Center, and we promote conflict resolution and social justice, and we have programs for schools, families, and the community, book discussions. I invite you to check out our website. We have a lot of programs and events going on. Thank you.
Thank you.
Jackie?
I'm Jackie Rogers. I'm with the coalition as a bill tracker for minimum wage, and also on Jobs and Ed and Legislative Committee, and I also service the representing AUW Doylestown Public Policy.
I'm Liz Downing. I'm an individual member of the coalition, and I'm a newly elected board member. I lead our post-secondary education committee, which has, I think, been moving forward rather well, and we're doing a lot of good work. And I'm also one of the liaisons from the National Council of Jewish Rights.
Great.
Good morning, Kristen Chapin from the YWCA. We're a partner organization with the Women's Advocacy Coalition.
I'm Susan Nord. I'm with the county with the Office of Housing and Human Services.
I'm Erin Lucas. I'm with the Bucks County Opportunity Council, also a partner organization. Tammy Story, Bucks County Opportunity Council.
Jan Bowe, first meeting here.
Welcome.
I've been involved with different community organizations over the years.
Glad to have you here. Sue?
I'm Sue Maslow. I'm on the board of the coalition. I'm also chair of the Leadership and Governance Committee. I've been a board member of Big Brothers Big Sisters for about a decade, and I'm just switched to advisory.
Joseph Baumhauer, I'm an individual member and I serve on the relationship development.
I'm Jack Santry and I'm a volunteer for the Rolling Farms Food Rescue.
Donna Butchko, I'm on the Leadership and Governance Committee. Wait, what's its name? And I represent partner members for Optimus International of Bucks County.
Fantastic. Eileen, do you want to go?
Eileen Reed, individual member, and also the Immigration Committee up in Doyle.
Okay.
Peggy Gator, I'm with the League of Women Voters, and I'm an independent member of, it's the League is a partner organization now.
My name's Holly Ganswell. This is my first meeting. I'm involved in a couple of different nonprofits, and I've heard such good things about this organization, so I wanted to come out and see it.
Welcome. Somebody next to you there?
I'm Nancy Morrill, and I'm one of the president emerita of the coalition, and welcome to Pennswood.
Thank you for hosting us, Nancy. Carolyn?
Yeah, Carolyn Perez, I'm with the AAUW Doylestown branch.
Great.
I'm Elizabeth Ozer. I'm from First Up. We're an early childhood organization.
Welcome.
Lydia Windeman, I'm an individual member here, and I'm on the Relationship Committee, the Education Committee, the Youth Group Committee, and the Caregiving. And I'm the new Welcome Committee. Some of you I've spoken to you on the phone over the years. So,
Great.
I'm Stevie Baggett, an individual member, and this is my first meeting.
Welcome, Stevie.
I brought her.
Fantastic. Barbara?
Barbara Price, I'm Vice President of the Board and represent AAUW
Laura Bucks on the board, and I'm chair of the Jobs and Education Committee.
Hi, good morning, everyone. I'm Kristen Ferry, and I am with Wood Services. We are a partner organization of the coalition.
Hi, good morning, everyone. My name is Dina Della Ducata, and I'm the CEO for Family Services, just recently, about 8 months. And this is the rest of my team, and they'll introduce themselves.
Hi, I'm Nikki Bettis. I'm the Director of Communications at Family Service.
Hi, my name is Muriel Kelly. I'm Director of Housing Services with Family Service.
Linda Mintz from Ben Salem, doing what I can to help women everywhere.
There
you go.
That's what we should have. Maria Evans, I'm an individual member, and I also lead the Marketing Communications Committee.
I'm Kim Bensing, and I'm on the Marketing Communications Committee also.
Great. We had a couple people just come in. Oh, Marcia?
Marcia Telhorster, and I'm on the board.
Okay.
Kathy Means, I'm on Marketing Communications.
And
the board.
our other new board member? Deb?
Hi, good morning. I'm Debbie Walkstress, and I'm running for Congress in PA1.
Welcome.
I am Susan Weidel. I volunteer at Family Services, and this is my first meeting.
Welcome. Welcome. Did I miss anybody else? Okay. It's great to have you all here. We're really excited. I want to just give you a little bit of background before we get started with a panel of our organization partners and their perspectives on the intersection of caregiving and poverty. If you haven't seen it yet, I'm really sad to hear that we are focusing on the economics of women in work this year. We're trying to make sure that that message, let's see, will this work for me? It was working, let's see. No, okay.
Do you want me to click for you?
Looks like maybe it's gone to sleep a little bit. Okay.
It's loading.
All right, well, I may be clicking manually, unless, would you? That'd be wonderful. Thank you. Oh, now it's back one. All right, it's messing with me.
If I need to.
Hi, welcome. Come sit. We have a couple spots in the front, and we have extra chairs on the side if people need them.
I'm Rosemary.
Rosemary, welcome. Glad to have you. So our theme reflects a bunch of priorities that we think are really important for economic security for all, and we tie them together to this message that when we lift the barriers to women's full participation in the economy, we lift the economy. And so what's good for women is good for our communities and our country and everyone. And all of these issues are priorities for us under this concept of our theme. And we sort of are thinking about how do we understand all of these issues. They're very complex, they're interrelated, and we're trying to make them clear to ourselves and to our legislators and to everyone through our communications so that people grasp the issue when we are trying to advocate around these things. Okay, so the theme is a focusing of our efforts, and it is an attempt to focus public attention on these issues. And the idea is based on our need to focus on the things that are baked into the system that are keeping women from achieving what they can in terms of their own economic security, and of course supporting and caring for their families as well. And so systemic change is really what we're trying to do here. And we're shining a light on the economic penalty of the wage gap and issues with career opportunities, stepping off of the career ladder if you're taking care of a family member, for example, lost Social Security benefits, and all the other implications, economic implications especially, of the interrelated issues that we're talking about, especially caregiving. So perhaps you've heard this before. This was the big aha moment for me when 10 years ago when we were getting started as a coalition. our partner organizations, we have 43 organizations that are partners in this coalition. And what we were hearing was, look, we're mostly serving women. Women who are single head of household, trying to make it in Bucks County, making perhaps minimum wage or something over it, but very unable to afford childcare, to access health care, and so many other issues that were affecting their ability to be self-sufficient. And we understand that poverty among single women would drop by more than half if we addressed, for example, just the wage gap. So these are the issues we're trying to focus on, and looking at these various different areas where we can hopefully be an agent of change. And one of those areas, well, this is our role, but one of those areas is the economic implications of caregiving. And so what we've done today is invited 4 of our partner organizations to give a perspective on the intersection of caregiving and poverty. And we have their slides, and we're just going to bring them up to talk briefly, and we're going to do all 4, and then if there are questions, we will ask them to respond to specific questions. So if you have a question early on, write it down, make a note, and then you'll have an opportunity to ask them. So Kristen, would you go first?
Absolutely.
And would you like to hold a little
No, I'm
clicker?
trapped. I have to do it from here.
Uh-oh. There we go. Okay. Would you like the microphone?
Sure, I think.
And the clicker?
Perfect, thank you.
Uh-huh.
Good morning. So I'm going to start out with an apology because I'm the panelist with the caregiving issue that Kathy alluded to. So I am going to have to run out of here at 10:30. But if anybody has any questions or wants to connect with me later, Kathy and Tam know how to reach me, or you grab me real quick and I'll get you my card. I'm glad to see St. Mary's is here because that's where I started my morning with my 10-month-old son. We were in the ER. He had a really high fever. It's an ear infection, and I'm sure it's probably not that big of a deal, but I'm a first-time mom, and it's the first time he's sick, so I'm like, forgive me if I'm a little frazzled.
She's here, though. You're here.
Yeah, I'm here. Oh, it's coming on its own. All right.
You can reverse that.
Yeah, no worries. We'll go back. Yeah, so that's my issue. I don't mind sharing it with all of you, and I thank you for your understanding of where I'm coming from this morning. But I do have to. My husband and I are, supporting each other throughout the day, so I have to cover him as he goes to another work event here in a little bit. But I am with Wood Services, as Kathy mentioned, and I'm sure all of you being Bucks County folks probably have heard of us at one point or another. But I've learned through conversations with the community that for years and years and under previous leadership, it was kind of ambiguous. How do I stop this from just going? No one's really sure exactly what we do, so I wanted to give you just a quick snapshot of that. We do care for people with special needs. We have the campus in Langhorne where nearly 600 people of all ages with special needs live with us. The youngest person that we serve is 5 years old, and the oldest is 87 years old. So really, when I say, we do wraparound care, meet all the needs of that population, we meet all the needs. We have schools on campus for our youth. We have vocational and job opportunities for our adults that are on campus, but also through our community partners. But beyond just the campus in Langhorne, Pennsylvania, we actually have affiliate companies and organizations, and we have in-home supports, group homes. So across our whole spectrum, we serve about 18,000 people actually throughout southeastern Pennsylvania and New Jersey. And we have about 6,000 total employees. So just on the campus that you may be familiar with, we have about 2,000. And about 2/3 of our workforce, so 2/3 of those 6,000 people, are what we call direct service professionals, DSPs. So when Kathy and Tam mentioned this topic to me, caregiving and poverty, I thought that we could really provide an interesting perspective because we have these DSPs who are caregivers for a living, right, in addition to back home, their family responsibilities. And the direct service professional workforce is one that is experiencing a crisis, not just in Pennsylvania, but across the nation. And not just for intellectual disability, but people who are in similar fields supporting, elderly, long-term care, even child care. A lot of nursing facilities have a similar problem. And, so as nonprofit organizations, we're limited in what we're able to pay as wages because we're completely reliant on government reimbursements, whether, that's state funding, whether that's county funding, whether that's education is different for each client. But that's kind of why this workforce is a little strapped. It is a low-paying workforce. And I think on my next slide I have some statistics about their actual wages. But these are the type of people that we're serving through those workers who are really just meeting all kinds of needs. There's no typical day or typical job for a DSP. You may be doing housekeeping, medication administration, hygiene assistance, feeding. So really it's a demanding job. It's a job that folks love. They love to do it. They really connect personally with our clients, and I've got some pictures of that, of our caregivers in action here as well. I love the mini horses. I missed it. I saw it on Facebook later than they were there that day. But there we go. All right, so here's what I'm talking about. Nationally, there is a workforce shortage. I do have some data just statewide for intellectual disability DSPs. The average wage is about $12.83 an hour. So if you're starting out, it's lower. It's $11.62. So obviously that's a concern. It's very, especially in a place like Bucks County, it's not a livable wage. So at Woods, we're trying to do what we can to support our workforce. We have healthcare incentives. We provide healthcare actually on campus. We have a medical center because we recognize that a lot of our staff is probably working 2 to 3 jobs already to make ends meet and can't prioritize their own healthcare. So that's one of the ways that we tried to prioritize our workforce. We know not every provider is able to do things like that. We have education incentives, but we are just concerned, this workforce in general, the way that all those things that Kathy had on her slide, the circle around the person, I was jotting them down because I was like, yes, we want to see wage increases, we want to see better health care, we want all these things that our staff are worrying about, their child care costs, how are they going to make ends meet. So one of the things that I did just want to convey to you guys today, I think that it's important to make the connection between this workforce and how it's impacted by human services funding at the state, but also at the federal level, because one of the issues that we talk about a lot at the coalition is the need for a minimum wage increase, and we completely agree that that is needed and we fully support it. But from the DSP perspective, we're just a little concerned that if the minimum wage is raised and human services funding is not also raised, that these are going to really quickly become minimum wage jobs. And I'm of the perspective that it's not a minimum wage job. It's very demanding and something that takes a lot out of people. So if it becomes a lateral move, if you can make the same money being a cashier at Target or lifting an individual with disabilities in and out of their wheelchair and meeting their hygiene needs every day, we're concerned that the vacancies and the turnovers that we're already seeing in that workforce would only increase. So again, completely support increasing the minimum wage, but also just want to make everyone aware that we could really use additional voices for the advocacy that we're already doing and our partners and our associations that we work with are already doing to help also raise wages for this workforce and for human services across the board. I did include one website that I'm aware of, fixtheDSPcrisis.com, and that is a advocacy effort of PAR and RCPA, some of these human services associations for Pennsylvania that you may or may not have heard of, but it's an effort where we're all joining together to try to raise the awareness of the need to increase human services funding as well, because really, people say, we need more funding for intellectual disability services. What does that mean? It goes almost directly to the wages and is really important. But so, Woods, I showed you that slide of all of the populations that we serve and how we're trying to meet everyone's wraparound needs and control the social determinants of health for all of our clients and make sure that they're eating well, make sure that they're exercising well, make sure that they have someplace safe and secure to live. And we can control that because we're the provider and we're providing those services, but we have much less control over that when it comes to our workforce. So we're trying to do what we can to fix that and offer other opportunities, but we can always use more partners from the policy perspective to help us push some of those things that we think would be helpful. And I love any excuse to share more pictures from this. So we got our little guy there. I think that's the end of me. Yeah, so again, thank you for bearing with me this morning when I'm frazzled and just frantically caffeinated really quickly, so I'm even more frazzled. But looking forward to hearing from the other panelists and ways that we can continue to partner with each other and with the coalition to make sure that we have a pretty large workforce just in our organization, and we want to make sure that they're supported and that we're doing everything we can to see that happen. So thank you guys. Thank you. Next we'll hear from Erin from Bucks County Opportunity Council, and hopefully your slides won't run away with themselves. I don't know why that's happening. I don't know how to stop it. Yeah.
It's like on autoplay or something. Yeah. That's okay.
I'm not the clicker person, that's Tammy. She's the ruler of the clicker typically at our agency. So I'm Erin Lucas and I'm the CEO at the Bucks County Opportunity Council. We are the community action agency for Bucks County. That's the anti-poverty organization. We're part of a national organization called the Community Action Partnership with over 1,000 community action agencies across the country. So every county has an anti-poverty organization. Did everybody know that? No. So that's pretty typical and something that community action is trying to change. They have not done a real good job of branding as one organization, and instead have really focused on solutions at the local level, which we want to continue to focus on those local level solutions, but understand that we're a network and that we're pretty powerful. We have a lot of ability to make changes within our community. So our approach to ending poverty is pretty simple at the Opportunity Council. We have an economic self-sufficiency program, and it really is just an individualized approach to supporting people as they make their way out of poverty. It's not a cookie cutter approach. We really try to meet people where they are and provide the supports that are necessary to help them move forward. That is pretty different than some of the typical safety net programs that are available, the welfare to work programs that are available that are really focused on just getting a job. We're really focused on a career pathway, on helping someone achieve the skills that they need so that they can support their family themselves. We have graduated over 300 families from that program, and that is about 1,000 people who have permanently left poverty. So they typically increase the average. When they start with us, they're earning about $10,000 a year. Many are earning zero, but the average is about $10,000 a year, and when they leave us, they're averaging around $46,000 a year. So, and there's a variety of career pathways that people choose. We don't choose for them. They choose based on their skills and their abilities and assessments that we do to help them move forward. Our whole focus is just making sure that someone has the supports in place so that they can move forward. And some of the things that graduates achieve at BCOC is employment at a family sustaining wage, which I think you all that resonates with everyone. Really important for us to focus on. 78% are Caucasian and 10% are African American. 21% of households in poverty are female head of household compared to 3% male head of household in poverty. So most of the people that we work with are in fact women, but we also work with men, and so I just want to make sure that everyone understands people in poverty are people in poverty. We're working with anybody to help them move forward. So when some of the things that we see at the Opportunity Council are when women are the sole caregiver of children, childcare is essential to employment, and the wait lists are long and have unrealistic requirements, like they must have a job before they can get on the wait list, but to have a job you have to have childcare, and so it's really a catch-22 for people where they'll look to and find somebody maybe that is less than desirable to watch their children while they get that job so they can get on the wait list. Through our emergency services programs, which we do a lot of emergency services for housing and utility assistance and a variety of things, but we see a lot of women who are facing eviction. They've lost their job or they're at risk of losing their vehicle because of a lack of reliable childcare. That is probably the number one theme of why people lose their job is they had unreliable childcare. And so they called out of work one too many times and lost that job. I already talked about people getting fired and leaving work because they had to. The school calls and they don't have anyone to go to. So those are some of the things that are facing our low income or our women with low income in our county. And then the other thing is that women are often limited in their job choices based on available childcare. So if there's not, if they're looking for something as a nurse, they want they'll often be asked to work the 12-hour shift, but it's an overnight shift, and there's not really reliable overnight shifts unless you have a family member or a friend who's willing to watch your kid overnight, which is a pretty big ask, I think. And so often we'll find people that will take a lesser job just because they can't find that reliable childcare. Some of the advocacy areas that we would like to see, of course, are affordable, flexible childcare for all, or options. Paid sick leave for all workers, that is also a reason why people get fired, because they have to leave when they don't have the hours and they don't have paid sick leave. Increased minimum wage, but I would agree that increased minimum wage with increase in human service dollars to support that, because that is going to be a really tough nut to crack without the money to fill it. And then pathways to living wage jobs that include supports for training and advancement. So I'm going to just give you a little story about Holly. Holly was a young stay-at-home mom, married to a man who worked full-time and took care of their family. But he became addicted to prescription pain medications when he got hurt at work. And then he lost several jobs, and eventually Holly decided to leave him. And she took her daughter and moved in with a friend, and they were doubled up and identified as unofficially homeless. Because when you are, the federal government does not determine that you are homeless unless you are literally on the street or in the shelter. If you are couch surfing, staying with a friend, you're not homeless and therefore not eligible for some of the federal housing programs that are available. Did everybody know that? No. Yeah. So the definition is pretty strict, and our friends at FSA can agree with that. It's pretty strict. So if you don't meet that federal definition on the street or in an emergency shelter, you do not qualify for housing services, for many of the housing services that are available in the county. So Holly had no income except for child support, and that was when he was able to pay it, because he was facing addiction and therefore was not reliably working, I should say. So she really relied on SNAP benefits and his child support to help get her through. Holly was taking a bus. She had no reliable transportation. She was taking a bus 2 hours each way to go to work and take her child to childcare. So she enrolled in our self-sufficiency program and started attending Bucks County Community College to become a registered nurse. We helped her get a car, so we gave her a donated car through our Wheels to Work program, and that was really the game changer for her. That reliable transportation helped her cut 4 hours off of her day and able to help her get to the classes that she needed to get to and also get to work. So we supported her with housing assistance, transportation, scholarships, and gift cards to meet her basic needs so that she could feel empowered to do school. She had the ability to do school, but without those supports in place, she could not succeed. So today, Holly is self-sufficient. She's graduating from our self-sufficiency program in 2 weeks. And she's working as a nurse. She is at a major hospital, and she's supporting her family free of government subsidy. She no longer needs those supports. Now, she is wanting to give back. We're going to tell her to work on her family and herself for the next year and come back to us next year and maybe become a board member at the Opportunity Council. But those are some of the things that are the biggest challenges for people in poverty in our county.
Excellent.
Thank you.
Sure. Good morning. I'm Rosemary Halt from Maternity Care Coalition. I'm the Director of Policy for Maternity Care Coalition. So just wanted to kind of really add and enrich some of the conversation we had already today, which has been wonderful. Maternity care was born in 1980, and primarily because the infant mortality rate in Philadelphia was higher than most third world countries. So we've been working on that for a long time. But this is Tammy. She was one of our clients.
And I wanted to just give you a little overview of Tammy's story because I think it really frames what we're trying to talk about today. But one of the things I have up here is you are meeting me on the page of the many chapters of my life. That was really a telling moment for me when one of our clients, not Tammy, told me this. She was suffering from substance use disorder and had a long traumatic history in her life. And it's, I got her on a bad day, and she really told me, she's like, you are judging me on this day, and yet you don't know the 10 chapters of my life. And she goes, and I know I have many more chapters that are ahead of me. And I think that's really important to frame a lot of the things when we're talking about poverty. Because it's really easy to say you should be working harder, you should be doing this, but there's a lot of factors that enter into why people end up in poverty. So Tammy came to our program. She was 18 years of age. She was pregnant with her second child. She suffered a long history of trauma and sexual abuse. She was being currently abused by her partner who she was pregnant, so she left that partner. But she was also suffering a lot of depression and anxiety. She was not making her prenatal appointments. She was almost kind of giving up. And so Tammy, through the work of what we call our advocates, which are our community health workers, was able to start on the path. We got her going to her prenatal appointments. We started helping her find housing. Always that key thing that we hear is housing. We helped her finish her GED so that she could, start on the path of looking for work. We helped her navigate, which is really, really hard, the healthcare system. I tell people, that's like our healthcare system is so difficult right now, and if you have a complex history, so if you're a pregnant woman and you have, mental health issues and you have a chronic medical condition, which was the 3 things that Tammy had, think about all those doctor's appointments. And then think of going into a big healthcare system and you're bringing a toddler with you and you're pregnant and it's a pouring rainy day and you're expected to be in this building for 5 hours and you can't get childcare because you're not working or so there's many barriers beyond just like the income parts of this. It's a lot of things that get in the way of people moving forward. But Tammy persevered with the help of her advocate. And she continues, when her son was born, did have some issues that required early intervention services, so we were able to connect to early intervention services. We were able to help her get a part-time job. And she's continuing to really be a great mom. She's so happy now, and she feels like she's empowered to do what she needs to do to take care of her family. But all of us at one point in our life need help. And it's just having, luckily her pediatrician was the one that referred her to our services, but luckily somebody in her life intervened and pointed her in that direction to get help. And there's so many great community-based organizations trying the same things here, so I don't want to say it's just us, but there's lots of ways, but it's sometimes making sure that person's getting the right help at the right time. And that's, I think, where the barrier happens in many counties, to be honest. So some counties are now looking at like centralized intake, which is, and I call it the no wrong door, right? So if you show up at a county services office, somebody shouldn't give you a list of 10 people to call. Because you're probably having depression and anxiety and a lot of other things happening in your life, and somebody handing you a list and say, call these 10 numbers and maybe one of these people can help you is not going to get that person to the right place. But having that person at that time say, hey, let me go through and let's help you figure out which is the way, and let me make that call for you while you're sitting in front of me is a much better way of making sure people are getting the services that they need. So just a little bit about NCC. We have like 5,000 families that we serve annually. We're in 4 counties. We have 20 different programs that we do. Our most intervention-based ones are Healthy Families America and Early Head Start, which are really intensive evidence-based home visiting programs. But we also do a lot of things like childbirth and doula. I brought papers with the 6 programs that we actually do in Bucks County. So I can leave that somewhere in the back there. Over here. But the interesting thing about Maternity Care Coalition is we always try to meet the mom where she's at. So if mom needs just a crib and a little safe sleep education, that's great. Some people really need intensive help like Tammy, and they need to be in our program for 2 or 3 years to make sure they're right on the path, that they're taking care of her and baby and all that. And then there's lots of stuff in between. So we try to fit our programs to the parent, not the other way around, which sometimes is the tricky part. And we also are right now and I think this is a really important point, and it was touched on a little bit, how the opioid epidemic has impacted poverty, and we'll have a huge 2 generations being the new epidemic. I could talk the whole day on that subject alone, but just want to let you know, and it kind of brings me up to this. So there's really a roller coaster of current political and policy landscape out there. So many things are impacting poverty, and I think we have to be realistic about some of these. And housing continuously comes up on this list, workplace taxation, all these things overlap in what we're trying to do around fixing poverty. And we're entering a political landscape of the 2020 elections, and I think it's really important that this issue of poverty becomes, especially for women, because women and families who are living in poverty right now are going to be the major reason why America is not great anymore. It's like, but it's really that we have failed to address that issue for a long, long time. Maternity Care Coalition, we are standing behind what we are saying. 3 years ago, we increased all our entry-level positions to a $15 minimum wage, living wage. And I'm not gonna lie to you, it wasn't easy. And we've had to do a lot of extra fundraising, and but we felt it was really important because many of our community health workers, who we call advocates, actually come from the communities that we serve, and many have actually been former clients. And so we can't really stand up and say, we are supporting you guys, but we can't pay you because we're a nonprofit. I mean, that, is just not the way to move the bar forward. So it's not been easy. Our board has many long nights trying to figure out how to keep the ship afloat, but we try. So I think, I really, again, applaud all the advocacy you guys do. I enjoy working with you a lot. I think there's a lot to be happening in Pennsylvania, particularly this year, so I hope that we're successful.
Thank you. Next we have Dina Ducata from Family Service Association, and when you're ready, we'll do that. Okay, great.
So good morning, everyone. I'm going to continue to echo what my 3 colleagues have been talking about here. And so I just want to tell you a quick little bit about Family Services. Family Services is an organization that's been grounded in the community for 66 years. Underneath Family Services, we have over 20 programs, and those programs are broken out into 3 major divisions. The first division would be considered behavioral health, and underneath behavioral health, we have mental health and drug and alcohol services. Our second division is community-based, and those community-based programs wrap around families, parenting, and our contact and information line. And then our third division is our housing division. And underneath our housing is our housing line, and also the Bucks County Emergency Homeless Shelter. Okay. So when I was asked to talk, I was really trying to think about, when we had the conversation, what would be the best focus? And from Family Services, it's really about housing and the impact from caregivers with poverty and affordable housing, especially in this county. So just some statistics I thought might be helpful. So there's over 10 million women aged 55 and older in the US. One study shows the real focus we've been talking about is women and caregivers, and there's a conflict with that role. And with that conflict causes an impact, and I'm echoing again what all of my colleagues have said here. It impacts a lot with regards to employment. 33% of women have decreased their working hours due to caregiving. 29% passed up a promotion or a training or an assignment because of their caregiving responsibilities. 22% took a leave. 20% switched from full-time down to part-time. 16% quit, and 13% retired. So there's some interesting statistics with regards to the impact on caregiving and how that impacts women financially and also their roles in employment. So there's 4 main key reasons that pose financial challenge for women. The loss of income and career opportunities, the cuts to paid work hours, and then because they have to meet their caregiving responsibilities, as we talked about, their hours decrease and their financials obviously decrease. Also, it reduces their Social Security and other retirement benefits because of the fewer hours of working. There's significant out-of-pocket expenses that we haven't really talked about when you're taking care of a loved one and you're the primary caregiver. And then the key that I really want to talk about is really the impact on what we call ADLs, IADLs, and housing. So most of you know what an ADL is. So it's an activity of daily living. It is regarding eating, bathing, getting dressed, and toiletry. An IADL is really a more complex task, paying a bill. Self-care tasks with regards to wellness, healthy eating, managing finances. And so when you're caring for a loved one, those are the things that impact a woman. And so we don't always think about those things, but there are the things that come into play when a woman is taking care of a loved one. And so I thought it would be helpful if I told you a little bit about a story. We're going to show a quick video, so I'm trying to keep within my 10-minute time frame. But Eileen is a woman who presented at our shelter. And Eileen, for all intents and purposes, her and her husband and her 2 kids were an American family. They both worked. They had double income coming in. And Eileen's husband was diagnosed with brain cancer. And she struggled for 3 years, taking care of him. He lost his job. She had to change her hours at work. The children were having challenges at school. And in school, they were having difficulty with the father and the caregiving issues. And so they were being bullied at school. She pulled them out of school. She homeschooled them. And I'd like to show you her video so you can have an understanding of the impact regarding caregiving and all of the challenges that a woman faces.
Everybody say a prayer now.
Yeah.
Been homeless on and off again for 2 years. I was widowed 3 years ago. Held on as long as I could till last April. I couldn't pay the bills anymore, and we kind of went from hotel to hotel at that point.
I don't know, we were going many places.
I ran out of funds. We lost the hotel room on a Friday, and I called, because I had been on the list prior, to being in here, and I called and they said, yeah, we can get you in today. And they came and actually picked us up from the hotel and brought us here.
The shelter is where you go when you don't have any place to go, or you're stranded, or you're lost.
It was different. It was not what I expected. I guess I kind of expected it to be like, you have to be out at 8 in the morning and you have to get back in line and hope you get a cot at night. But we're actually residents here, and when you have children, that's a burden lifted off your shoulders that you can't even imagine.
I feel like this is a good place, and that I get 3 meals a day, I get everything I need, and that is just way better than living in the woods or something.
The level of caring really surprised me, and it was such a good feeling. It really was, to know that people were here that cared and wanted to help. If I need assistance applying for programs, they're there. If I feel like all of this is overwhelming, and there are days I do, if I said to Sue, please, I need an appointment, with FSA counseling, they would do it. Getting a job, discussing with my children if they want to continue homeschooling, and that, I guess, is going to depend on the school district I end up in. Basically, providing the most stable home I can for my kids. They haven't had one in a very long time. People don't understand fully what it is to be homeless until you are. I never did. If this facility were to lose whatever funding it gets, and it had to close its doors, it's not just me that would be affected. There's so many other people, and when I leave here that fast, my spot here will be filled by somebody else who needs it. It's not easy. This is not an ideal place to live. It is not an ideal way to raise your kids. But I look at it as a stop-off point to things getting better.
So from an advocacy standpoint, I'm going to echo with regards to employment. It's not just about raising the minimum wage. It's also about funding, and that ties in. Because for all of us in this community who are leading these organizations, the funding levels in some areas have not changed since 1970. Can you imagine living on what you made from 1970? As leaders of an organization, we are struggling with funding, being asked to do more, increasing the level and the quality of services, and pushing our staff on the same dollar amounts we've had from back then. So when we talk about advocacy comes in so many different arenas. It's not just raising the salaries, it's talking about funding, and funding in different arenas. You saw there what it costs for us to run this shelter. And again, we're not a typical shelter, so the costs are higher. But that increases our success rate for someone to find affordable housing and stay in that affordable housing. So there's many areas for advocacy. My time is up. But I would be remiss in not asking Muriel to stand up, because she runs and oversees our homeless shelter. And staff do a phenomenal job. So thank you every day. It is not easy, and I just want to say thank you to you and your staff.
Thank you.
That's great. Wonderful. Don't go far.
Okay.
Does anybody have questions for any of our four presenting organizations? Sue?
I just have, I guess, a comment rather than I understand about employment and support that. I understand where funding is support for the county with the Division of Housing and Human Services. I know about limited money coming in. I think there's a third thing, though, that we'd be remiss in putting this puzzle together. We know that when people leave welfare, they lose a lot of their benefits. And there's that tier in between self-sufficiency and getting benefits. So as we're talking about getting people working, raising the minimum wage, what we have to do, and someone else alluded to it, I think we have to really look at the rules and regulations for the child care, for transportation, whatever, because just raising their wage will probably not help them much, because then they'll lose some of the other things for which they're eligible.
Right.
So I just want to, there's a third piece to this, side to this triangle.
We've been advocating around the cliff effect, and I think that's sort of what you're talking about. Like, there are these levels where you lose a benefit that is the thing that allows you to keep working, and you're not ready to pay for it yourself yet, but you can't really keep working without it. So we're working on
we keep fighting. So I think
understanding.
that's the third piece to this triangle, because I don't want to get their wages up and then they're in worse shape, which is what we've seen.
Right. Go back to start. Did you want to say something?
Yeah, I think that's really relevant. When we raised the wage $15 an hour, we had staff that didn't want that because they were going to lose their child care subsidy. Right? So, you know, it's great to raise it, but if we are bumping them off something that gives them more and helps them take care of their kids so they can, it's a really, it's a whole system thing. It's not just one lever. If we push one lever, it makes something else do something. And so I think that's really important to keep in mind.
And that understanding is what we gain by having organization partners as part of this coalition who can make that really clear by showing us the experiences of their clients. So that's really important. Chris?
Hi, I'm Christina Finello. I'm the Deputy Director of Bucks County Housing and Human Services. And I first want to echo what Dina just talked about in terms of the funding. You know, the county as the Housing and Human Services is the gatekeeper of the money that comes from the state. And we only get so much. 6-7 years ago, there was a 10% cut to human services funding that came to the counties. And we have not seen that restored. And to talk about how we pay to our providers and how they pay their staffs, there's cost of living increases that happen every year and should happen every year because people are doing such a great job. But again, that then decreases the amount of money that we can put through programming because we are flat funded. So I urge you again to continue to advocate around that funding piece because we are merely but the gatekeepers. And I work with many of the people in this room in the organizations and take the feedback in around the things that they're seeing on the ground level because it's so important to be able to take that then to the state and tell them that we need to do this differently or there are things that we need to do differently. And then something that one of the other speakers said that I wanted to talk about really briefly. As we move to the county, we are actually going to be co-located. All of the departments under Housing and Human Services will be under one roof up in the administration building. Housing and Human Services in Bucks County, if you don't know, oversees mental health and developmental programs, drug and alcohol, aging, child welfare. Our Medicaid population gets behavioral health services and housing services. And as we reach the point where we're being co-located, we will have a one-stop shop center on our first floor of the administration building so that people can come in and get that personal touch and be able to not just get a list of 10 numbers and then figure it out on your own. We want to make sure that we work hand in hand with the people that are trying to get our services and navigate our services because it's not easy. If I had a day where I only had one person that was involved in one system, that would be an easy day. Every day I see people who are involved in multiple systems involvement, and we are trying in the county as well. Speaking of legislation and things like that, we want to be able to communicate better so that one hand knows what the other hand is doing. And some of the laws around that are restrictive, but we're working to make sure that we have a seamless system where people can get the things that they need. But again, I just continue to urge you to advocate for this. Thank you.
All right, I know we probably love to have a lot more comments. We're running short on time and we have to do some announcements from the beginning that I pushed back in order to get our speakers through. We have time for maybe one more comment? Deb?
Hi, I'm Debbie Waxpress, and
it seems to me when you talk about this as a systems issue, there are so many issues coming up here related to poverty, housing, childcare, wages. We watch a woman like this, and I think we all want to cry for